Hey Shelly, I'm here to do your head, eyes, ears, nose, throat, and neck assessment today.
Excellent.
Do you have anything you want to tell me about in that area first before we get started?
No, ma'am, I've been feeling great.
Awesome. Alrighty, so I'm going to go ahead and start looking at the top of your head. So if you could just hold your head down, I'm just looking through your hair, making sure it's evenly distributed. I don't see any male patterns. No nits. Let's see. I don't see any lesions or um, any hard lumps. It's atraumatic. Look down here on the back side again. Okay. All right. Next, I'm just going to check your facial expression. Smile for me. And puff up your cheeks. Lift your eyebrows. Okay, all of that. I was checking your cranial nerve number 7, your facial nerve. Okay, and I'm going to check cranial nerve number 5, trigeminal. What does this feel like? Soft. Okay. How does this feel? Sharp. Okay. So that checks for pain as well. That's what we look for in your trigeminal nerve. Okay. So next, I'm just looking at your face. I see closed comedone, the bottom and at the top. Face is round, it's symmetrical, nose midline, eyes bilaterally symmetrical, and mouth. I don't see ophthalmos in your eyes. I don't see a moon face. Let's see. And I don't see any swelling, any rashes, eczema. You having trouble with that?
No, ma'am.
Okay. Alrighty. So let's go ahead and look at your ears. Alright. So I'm just going to hold back the auricle pinna and push it up and back, and I'm palpating it to the tragus and the pinna. Does that hurt?
No, ma'am.
Okay. I'm looking on the outside. I don't see any inflammation or redness. All right. Let's look down into the auditory canal here. All right. I see some lumen. And I also see the tympanic membrane. It's nice and translucent, pearly, gray. All right. Let me look at the cone of light. At the 5 o'clock on the right side. Behind that is the umbo and the handle of manubrium and the short process. Okay, so to test that, I'm going to say something and cover one of your ears, and I'm going to whisper it and you tell me what I said, okay?
Okay. Hello.
Okay, so that just tested your cranial nerve number 8, vestibulocochlear, okay? All right, so just going to come up underneath your ear, check your mastoid process here. Any pain?
No, ma'am.
Okay, can you open and close and open and close? You don't hear any crepitus? You don't have any issues with that?
No, ma'am.
Okay. All right, next we're going to look at your eyes. And just looking at your eyebrows, they're thinner, but your eyelashes are full and evenly distributed. Okay, so now I'm going to check your cranial nerve 2, the optic nerve. We're going to look at your visual acuity and also the reactivity to light And the oculomotor, which is cranial 3, is going to be constriction. Okay, so I'm seeing the prolap. The pupils are equal, round, reactive to light, and the accommodation I'm checking also with oculomotor. Cranial 3 is at the midline, and seeing that you watch, not moving. Okay, awesome. All right. Now, one more thing I'm going to do before I actually get out of that area is the 6 cardinal positions of gaze. Okay, so I'm going to hold it up here. I want to check your oculomotor muscles. It's also. So we'll move out. We're going to go up, and remember to keep your head in the same position, just your eyes. Very good. All right. So now I'm going to move to your nose. And I do notice that you do have a piercing on your right nostril. Do you have any trouble with your nose or any kind of drainage, sinuses, allergies?
I do have a history of allergies.
Okay, so let's palpate here and feel your frontal and your maxillary sinuses. Are they full? Do they feel full?
Not today.
Okay. Or painful?
No, ma'am.
Okay. All right, so I'm going to look in your right ear. So we're going to lift your head back. Going to look up. Okay, so I don't see a deviated septum. Nose is at the midline. I don't see obstructions in there. No drainage. And your turbinates are not thickened. Okay. Next, we'll just take a look at your mouth. Okay. And also, if I had had something in here for you to smell, that would have definitely been a good one for your olfactory and cranial one. So anyway, all right, let's check your mouth, okay? So just looking at your lips, they are nice and pink. You do have a herpetic lesion on that bottom lip. So what I'm going to do is just pull your mouth open here. Let's look in here. Let's look at the mucosa. And look on the sides. Look at the top of the palate. Your hard palate is nice and white. Your soft palate is pink. Now let me see your teeth. All right, nothing cracked, chipped, missing. All right, let's look at your gum lines. Okay. All righty, and now what I want you to do is open your mouth, and I want you to say ah. Okay. So with this, I'm checking the cranial nerve 9, which was the glossopharyngeal, and I'm also checking the vagus. I also saw the uvula moving up and down on the posterior phalanx. Yep. And your tonsils, they're about 1 plus. Will I see any reddening? Lesions, no lesions in there. No abscess on the throat. The phalanx. Okay. So what I'll have you do also is go ahead and stick your tongue out and wave it side to side. Okay, and that is your hypoglossal, which is cranial nerve 12. All right, so one more thing. Go ahead and lift your tongue up. Just want to see the frenulum and the submandibular glands underneath them. Now that looks really great. Okay. And Next, I'm going to go ahead and check your lymph nodes, okay? So I'll go behind you. Had any issues with that?
Not recently.
Okay. So we'll look at the preauricular, which is right here. Just gonna palpate and feel this. The posterior auricular. The occipital, which is, you can go ahead and put your head down just a little bit at the base of the skull. Not feeling any nodules, any masses, lumps. All right, so then we'll do the tonsillar right here. Don't feel any thickening, nodules. All right, next we'll do the submandibular. Okay, then I'll just check the submental. All right, now I'll do the anterior cervical chain right down the sternocleidomastoid muscle. Okay, and I'm going to do the posterior cervical chain nose right behind your neck here, almost the trapezius. And then we'll do this last one here, the supraclavicular. It's going to be right in here. And no nodules. Okay. All right. So go ahead and shrug your shoulders up and down. All right, I'm checking for cranial 11, the accessory. Same for the hand, for the resistance. Okay. All right, and then I'm going to check your thyroid. I'm going to palpate that as well, okay?
Excellent.
All right. So. It's not enlarged. But right here, on the left side, I feel a small little lump. It's tiny and hard. And we'll have that checked. All right.